So we'll move on to the next question.
Hello ma'am, I am Sharila doing my MCA. I have a doubt about cervical cancer. How common cervical cancer, and is there any vaccine for cervical cancer?
Cervical cancer is actually preventable because we can identify cervical cancer at a very early stage by diagnostic tests like pap smear now.
Okay.
So the most commonly the cervical cancer has got a bimodal peak, that is it peaks at 30 years, 30 to 40. And then again at 60 years.
Okay.
So it is very common cancer in India. In a developing country like India, we don't have regular cervical screening test for our women. So there is an increased incidence of cervical cancer in India.
Okay.
So, but in the young generation, I mean below 25, I don't think there is a need for cervical screening at all, because the incidence is very, very low.
Okay.
And the most common cause of the cervical cancer is a virus, that is a human papilloma virus, and which can remain in the cervix for a long time and can induce cancerous changes in the tissue, which leads on to the formation of cervical cancer. It's rightly said that newer vaccines have been developed right now. There are two types of vaccines. That is, one is a Cervarix vaccine, which takes care of the HPV type 16 and 18, which is the most common subtype which is causing the cervical cancer. And the other one is a Gardasil vaccine, which takes care of 16, 18 and other two subtypes, which also takes care of the anogenital warts, which is also associated with the human papilloma virus.
So this cervical cancer, how does it come? Is it only through the sexual activity?
Yes, mostly because in young age group there is definitely there is increased chance of having changing partners and things like that, especially nowadays. So it has been proven to be an important cause of cervical cancer.
Okay.
HPV.
So when cervical cancer is diagnosed, or before going to the diagnosis, like what are the symptoms of cervical cancer?
Yes, once you are having cervical cancer, most common thing will be a postcoital bleeding or an abnormal vaginal discharge. Postcoital bleeding can be there due to other causes also, but main thing is the postcoital bleeding, and the other one is the abnormal discharge, that is blood stained discharge, offensive vaginal discharge. These are the things that are usually noticed.
Otherwise, is it like immediately after intercourse, or like otherwise also do you have?
Immediately after intercourse, usually you get the postcoital bleeding sometimes. But it's most commonly in the after 30 to 40 only this comes.
Okay, so
in younger generation, I don't think in the younger generation we need to focus on preventing this in future. So we have to vaccinate our young girls actually.
Okay, right.